Hello viewers, this is Dr. Sangeeta Datta, consultant psychiatrist, and today we shall discuss about specific phobias. Specific phobia, as the name suggests, indicates a phobia or phobic response or fear response towards a specific situation or object, insect, etc. For example, we can talk about phobia of the darkness or fear of the darkness, which is called nyctophobia or melanophobia. Fear of black is called melanophobia, fear of darkness is called nyctophobia. You can be afraid of an insect. Let's say, for example, you can be afraid of spiders, which is called arachnophobia. Some people are afraid of heights, and it is called acrophobia. Some people are afraid of flying in an aircraft, and some people are afraid of closed spaces, which is called claustrophobia. An example of claustrophobia is being afraid in a lift, and so taking the stairs always and not taking the lift to actually go to another story of a building. And there is another phobia which is called agoraphobia, which means fear of open spaces. You must have come across people who feel very suffocated in open fields, open skies, under the open sky, and they feel scared and they come inside their houses. So this is called agoraphobia. Usually people, when they are scared of a particular object or situation, that is, they suffer from a specific phobia, they try to avoid that situation and run away from it. Agoraphobic individuals, for example, when they go to a shopping mall, they would look for the exit areas first, because they already feel scared that they might feel suffocated while they are still inside the shopping mall. Or fear of, as I said, it is also fear of open spaces. Sometimes they run away from open spaces to a comfort zone. So there are multiple hundreds and hundreds of phobias, and we cannot give the example of each and every phobia, but these are some very common examples of phobia. And so once you come to know that this particular person has a particular specific phobia, you know what kind of a phobia it is, and it can be treated. Specific phobia usually happens because of some conditioning issues in childhood. In other words, if a child has been exposed to situations and incidents which create a fear in the mind of the child in early childhood, in the formative years of his or her life, which creates a fear about a particular situation or an insect, etc., then the child could develop a specific phobia. For example, fear of spiders may be actually inculcated in the mind of a child from early childhood, saying that it's poisonous, if it bites you, you might fall dead, so on and so forth. So when a person has a specific phobia, usually he avoids that stimulus or that situation, and such avoidance might deprive a person of a normal, healthy life. For example, if a person works maybe on the 4th story of a building and he has to take the stairs every day, and he also has some knee problem, so it becomes almost impossible for him to continue with the job because he cannot take the lift. Instead of that, if he takes some treatment from a psychiatrist or a counselor or a psychologist for his specific phobia, namely claustrophobia, then he will soon be able to take the lift and he will be able to continue with his job. Therefore, a specific phobia may sometimes handicap a person and might prevent him from performing his regular day-to-day activities normally. Therefore, if you have a particular phobia or a specific phobia, or you see someone in your family or a friend to be suffering from a specific phobia, please do not delay and do not rather go to a psychiatrist or a mental health professional. There are medications which can be prescribed which will give you instant relief and very early relief. And there are other counseling and psychotherapeutic methods, especially systematic desensitization, which can be given to such patients, to such clients. They can be taught relaxation techniques, and that way they will be able to completely recover from that specific phobia and live a healthy, normal life. When we talk about systematic desensitization, it is a technique where a person is exposed to certain cues and triggers in the form of some imageries or in the form of some pictures, and he is made to imagine that he is in a situation which he normally fears. And if he develops an anxiety response to that, he's also taught how to relax. Let's say he's taught deep breathing exercises, he's taught Jacobson's progressive muscular relaxation, etc. So after a man or a woman, for that matter, who has a specific phobia is taught systematic desensitization and also takes medications in particular cases, this person can recover from specific phobia and live a normal life. Do remember to like this video or subscribe this video, and we promise to come back with a more interesting topic. Till then, take care.